This is you. You're involved in running a busy medical practice. You do your best to deliver high-quality healthcare to your patients. But, like many physicians, you have come to the conclusion that your traditional practice model just isn't allowing you to focus on your patients, you, your family, or even your future. You feel like you're working more for the insurance companies than for your patients. You've also noticed that the traditional way of doing things just isn't providing the level of care your patients need or desire. Every day, you're facing decreasing insurance and Medicare reimbursements, increasing loads of paperwork, administrating health plan headaches, and riding the hamster wheel to survive in an encounter-based system. To support a practice in today's environment, you have to see more patients to support your overhead. These are your patients. They like you, but they don't like waiting, sometimes for hours, in a crowded room with a lot of sick people. In fact, many of them would rather be anywhere other than your waiting room. They also don't like spending just a few minutes during each visit with you. For some patients, it's knowing that they will see more of your staff than they will see of you, and that bothers them. Others think, why can't they just call in my routine prescription or answer my simple question over the phone? Why do I always have to schedule an appointment? And why does it always seem to take the whole day? One patient just doesn't like taking the afternoon off of work. He has too much to do, and it makes his boss unhappy. Is there a way that I can still practice medicine, but become a lot less reliant on insurance? Maybe you're wondering, how do I create an appealing medical practice in my community that patients love to be a part of year after year? Or how can I create a practice that allows me to really get to know my patients again, and to practice medicine the way I know it should be, not the way an insurance company thinks? How can I structure my practice to where I have time to ask my patients, is there anything else, without fear of falling behind in my schedule? Can I realistically convert my practice to an irresistible model? Can I do this and still support the income and lifestyle needs that I have now and will need in the future, especially when it comes to retirement? A few years ago, doctors like you realized that the communities they lived in and the patients they served didn't need just another doctor's office. They needed an irresistible, inviting, warm environment, a medical home where patients could come, relax, and sit down with a quality, experienced, unhurried, and caring doctor that had plenty of time to see them. One who would really get to know them again. This is the model of medicine that finally made sense. Concierge medicine. You see, concierge medicine doctors spend more time with their patients because they've discovered a practice in business design that puts a ceiling on the number of patients accepted into the practice. When doctors adjust their practice from thousands of patients to 600 or less, each doctor is now able to spend more time with each individual patient. Over the next few years, many patients found doctors like this all over the country. They loved it and told their friends because they felt safe enough to come back again and again. And the doctors and nurses involved in running these practices were very happy. Well, we have some more answers. What we've learned we'd like to share. We call it Concierge Medicine 101. And the self-assessment is brought to you free by Concierge Medicine Today. At CMT, we partner with high-quality, experienced physicians like you who desire to practice this type of quality, relational, irresistible medicine. Concierge Medicine 101 will help you learn more about what it takes to convert your practice to a concierge medical business model, the pros and cons, explore patient benefits, the rules and legal guidelines, and much more. To get started, simply complete the self-assessment here on our website. Someone will contact you shortly, and they will describe what concierge medicine is like for physicians, patients, and the various options you have so that you can enjoy practicing medicine again and spend more time with your patients and be less stressed. They'll also help you learn about the right concierge medicine business model that will fit you and your practice and meet your personal needs. Complete the free self-assessment today and find out just how simple and beneficial concierge medicine can be in your practice. This will make you very happy.